Do you know that muscle training can help conquer cancer and protect against cancer? Japanese surgeon Norihiro Sato, MD, recommends muscle training for all cancer patients, no matter what stage they are in his book, called Just 3 Muscle Exercises to Conquer Cancer. Researchers have shown that muscle mass is a very important factor in determining whether cancer treatment will be successful. An analysis of 2,863 cancer patients in the US using questionnaires found that those who exercised more than once a week live longer and had a 33% lower overall risk of death from cancer and other diseases than those who didn't exercise at all. Muscle training and other exercises can also help prevent cancer and its recurrence. Survey finds that about 90% of patients with recurrent pancreatic cancer develop sarcopenia. Researchers in the US carried out a study to see if exercise habits such as muscle training were linked to the risk of 10 types of cancer. They found that 215,000 people who used dumbbells, barbells or other equipment for muscle training had a 25% lower risk of developing colorectal cancer than those who didn't exercise regularly. Results of an immunological study of 573 women with colorectal cancer showed that the group of people doing exercise actively had a reduced recurrence rate and a 50% improvement in survival compared with the least active ones. As to why muscle training has a protective effect on cancer, it is still being studied. There are several inferences. Long-term mild chronic inflammation and diabetes are more likely to cause cancer, while muscle training can suppress inflammation and high blood sugar. Also, muscle training increases the activity of immune cells such as natural killer cells. In addition, substances released in the process of building muscles can inhibit cancer. For example, myokine inhibits the proliferation of breast, lung, prostate and pancreatic cancer cells. Interleukin-6 not only has good anti-cancer effects, but also strengthens the immune cell's ability to attack cancer cells. The book introduces 3 highly effective and simple exercises that can help patients conquer cancer. All these 3 methods are bodyweight exercises and don't need any other equipment. The first one is push-ups, which strengthen the upper body muscles. Do 2 to 3 sets of 10 reps a day. The second one is the plank, which works the abdominal and trunk muscles. Do 2 to 3 sets of 1 minute a day. The third one is the squat, which strains the muscles in the lower body. The recommended intensity is the same as the first one. The intensities can be adjusted according to your own situation. The most important thing is to learn to do each exercise correctly. Since certain load may cause slight muscle fiber damage, the same part of muscle shouldn't be exercised every day. It's best to train it every 2 days, in order to ensure that the muscle can get sufficient rest and recovery. In addition, muscle training combined with aerobic exercise can't only make cancer treatment better, but also reduce the side effects of cancer drugs. The American Nutrition and Physical Activity Guidelines for Cancer Survivors recommends at least 150 minutes of aerobic exercise and 2 to 3 times muscle training per week. The American Cancer Society encourages cancer patients over age 65 to try to keep up the same amounts of exercises. However, if there are other chronic disease limitations, you may have to avoid prolonged exercise and training. It's necessary to consult your doctor while making plans for exercise and training. According to Bill Bryson's The Body, everyone has 5 chances to get cancer a day. If you don't have cancer, thank your body and immune system. And one of the things we're able to do for our bodies is to train our muscles to protect against cancer. If you already have cancer, you can also improve your immune system through muscle training and expect better treatment results. Wishing you a speedy recovery. Above is all for today. Thank you and see you next time.